So for those of you that don't know me, my name's Dean. I'm an ST2 paediatric trainee currently working at King's in neonates and with an interest in paediatric emergency medicine. And I thought today I would talk about how to communicate effectively with the transgender population in paediatrics. Just briefly how this came about. Effectively, it's from personal experience that I've had on the wards over the last few years, having started my paediatric training and before that being a clinical fellow in Penn. And then also was based on a talk I went to that was organised by St Heliers, organised by someone called Joanne Lockwood. And she's a lady that has made this company called See Change Happen, and she does a lot of talking about how we can be negatively treating transgender people, not just adolescents, just in general over the NHS. And it made me think that actually maybe there's a lot of things that we don't really realise on a day-to-day basis that we might be doing when we're coming across transgender patients in our care that might actually be having a detrimental effect. Things that I, even myself, would maybe do that I didn't realise I did. So I'm only going to talk probably for about half an hour maybe, but we will see how we go. So how I'm going to run it is that I'm going to just show some cases that illustrate what sort of led me to doing this talk, and then discuss why I think it's important that we have this talk. Give everyone an opportunity to clear up some common terms. I think a lot of the problem when it comes to talking about transgender issues, especially when it comes to talking to patients who are transgender, is maybe that there's just some confusion in some of the terms that are used, what is okay to say, what is not okay to say. And I think that sort of hesitance can make things a bit worse. So I want to try and make a space where people could feel comfortable asking questions without offending anyone. I then want to move on to talk about some of the barriers for the transgender community in the NHS, and then also talk about some safeguarding issues that come with, specifically with adolescents that are using our care system. And then finally think about what we can do as a profession to see what other things we might be able to do to help. At the end, there's some useful links and reading for everyone to get on board with. Just some sort of effective house rules and stuff before I start. I personally am a gay man and I'm not transgender. So there'll be some things that I talk about that I don't have any personal experience of. I won't be able to say I've personally gone through a lot of the things that I'll talk about. However, I think of myself as a trans ally. I have lots of transgender friends, and my partner is currently thinking about their gender identity, and that's been a learning curve for them as well as for myself. And I still now, sort of months into them thinking about their identity, misgender them accidentally. So it's been a learning, everything has been a learning curve for me. And I think this is a sort of topic that all we can do is continue to educate ourselves. I think I want to sort of make a safe space to ask questions. I've done this talk twice before, once at King's, once at Heliers, and that was in a small group setting and face-to-face, which obviously is pretty difficult to do now. And I appreciate that that might be a bit more transducive to asking questions that you want to ask. But please, if you feel comfortable, please ask questions in the chat and I'll try and answer them. Disclaimer, I don't know everything about this topic and I mightn't be able to answer everything that you ask, but I should be able to point you in the right direction if there is something I don't know about. And really importantly, it's a discussion. It's not necessarily teaching. It's a dynamic process without right and wrong answers, and it's a human thing. So there'll be a lot of it that is about discussing rather than actually giving teaching points. However, I hope to be able to give some ideas near the end about what we can be doing to support the transgender community accessing our healthcare. So I just want to quickly talk about two cases first that really led me to this. The first one happened a few years ago, and it was a 14-year-old boy that was attending the paediatric emergency department who was born biologically female. And he'd attended the PDD with self-harm. Unfortunately, because of the way that the computer systems worked at the place I was at the time, meant that he was booked onto the A&E system with his birth name, which wasn't the name that he was using at the time that we saw him, as well as his birth gender. So he was on as a female. And that created a bit of anxiety amongst the team before people went to see him to sort of assess him. A lot of people were asking how they should approach him, what they should say. And that made me think about how difficult it must be for this boy who's came to access our care in a time of crisis, in having self-harmed and obviously having difficulties with some respect with his mental health. And we potentially, as staff that are predominantly there to help and support him, might have made things a little bit worse by giving the impression that we were a bit concerned about how we were going to talk to him and how we were going to approach him. And this was from a lot of people that I think of myself as a gay person as LGBT allies. So I think it's quite ubiquitous in everyone that this sort of thing, if you don't have a real personal experience of it, it might be a bit difficult to approach. The second case is a bit more dramatic, and this happened just last year. And this was as an inpatient on a children's ward. And again, it was a boy that was born biologically female who had been admitted for joint care with CAMHS and paediatrics following an overdose. There was a local registrar on that weekend, and during handover, when the list was getting discussed, this local registrar publicly said something along the lines of, she's probably done this because she was dressed as a boy as a child, as in she's probably identifying as male because she was dressed as a boy when she was a child. And then went on to say that she is being selfish having this overdose. What is she doing to her poor parents? And this really surprised me. Not only was she using the wrong pronouns for this person, she was also quite, for me, quite offensive. And this is a person that before I'd worked with previously and I had never had any difficulties with, was a very sound paediatrician. But it made me realise that actually there's a lot of people potentially out there that have different thoughts to what is probably conducive to treating transgender patients effectively. And as I've already said, after that I went on a really good talk by Joanne Lockwood, who goes around presenting to different members of the NHS on how we could be effectively communicating with transgender people outside of just the adolescent group, but across the board. And some of the things that some of my colleagues at that time were asking were quite surprising for me, things that I didn't think were appropriate to be asking a transgender person. And it just made me think that maybe a bit of education might go a long way. And that's sort of where this presentation was sort of created. So I'm going to go on to talk about why should we care? Why is this actually a thing that we should be talking about? Just a quick disclaimer about this bit is a lot of the data that I have is on the LGBT plus banner, and not specifically about transgender children and adolescents. And the thing is, it's a lot easier to find surveys that look at the entirety of the LGBT plus banner than specifically transgender, but I do think it's pertinent to look at some of these figures, and I'll explain why as I go along. So there was a national survey sort of in the middle of the 2010s, by 2015, 2016, that found that 4.1% of 16 to 24-year-olds identify in some way as LGBT plus. Does everyone understand what LGBT plus is? Is there any confusion with that? I know when I've done this talk before, people have been a bit confused about LGBT versus LGBT plus versus LGBTQIA. Does anyone have any questions about that? Basically, it's I think everyone gets a bit hung up with the acronym, and actually it's more about trying to be inclusive of everyone. Not everyone will necessarily want to have a label. Some people find real benefit in having a label. So LGBT plus works on saying lesbian, gay, bisexual, transgender, and everyone else that it might have a label that they want to identify under this banner of inclusivity. But going back to, as I said, 4% of 16 to 24-year-olds identify as LGBT+, and that isn't necessarily our age group. But NHS digital data later on in 2018 found that 10% of 14 to 19-year-olds reported themselves as LGBT+. And I think that's a huge number. So that's potentially 1 in 10 patients that we are going to be seeing as paediatricians, potentially in paediatric emergency medicine in our clinics, is inpatients, will be part of the LGBT+ banner. And whilst I don't have a specific number for how many of those patients or people specifically identified as transgender, you can infer that it's a reasonable number. So even in a standard setting that we were going to be seeing over the next few years as clinicians, we'll be seeing more and more patients accessing our care for physical health problems that are unrelated to their sexuality or gender, but we could be inadvertently causing problems if we aren't comfortable talking to them as a transgender person. Added on to that, increasing numbers of children are referred to the Gender Identity Development Service. This is a service run through the Tavistock in London, and they've got other sort of bases around the UK. And they support under 18-year-olds who are having difficulties with their gender identity. Anyone can refer, and I think it's one of the things that you have a look at after this talk over the upcoming days. If you're interested in it, it'd be really useful for you to have a look at their website. You can just Google GIDS, and they've got loads of good information for parents, for the children that might want to go to them, and for healthcare professionals. And as a paediatrician, you are in complete right to refer children, if you feel appropriate, to this service. It doesn't need to go via a GP. It doesn't need to go via CAMS. Anyone that is in the healthcare profession can refer. Unfortunately, the wait time is crazy. It's about 2 years when I last checked, but they are a really good service if you think you find a patient that would really benefit from some extra support. And then also the Lancet produced a survey in 2018 over a few years that showed that LGBT plus youths are 4 times more likely to self-harm. And I think that's also really important because I've already said that we're going to be seeing a lot of LGBT plus, including transgender children, coming through our services for physical health problems, but their mental health burden has been shown on many occasions through different surveys to be so much higher than the general population. So we're going to be seeing lots of children come through with mental health crises, mental health problems, predominantly accessing A&E, I imagine. As paediatricians, I think that's where we're most likely to come across these patients. So I think we need to be more aware of them as a group of people. So this is just a graph showing the number of referrals made to the Tavistock and Portman GIDS service. As you can see, the number has gone up massively, even in 5 years from 2010 to 2016. And you can imagine, if you look at the increase in that graph, how much bigger that number might be now. So this is huge numbers. We're not dealing with like the occasional person here. There's lots and lots of adolescents now that are potentially struggling with their identity. And I think it would be naive to think that it's something that we don't need to know about. And going back to the Lancet 2018 paper, and they looked at rates of depression and self-harm in adolescence and young adulthood in sexual minorities compared to heterosexuals in the UK. Once again, I'd like to reiterate that this is just LGBT plus inclusive rather than transgender people in general. But you can see from the graph, the y-axis is the mean SMFQ score. This is basically a questionnaire that you can give to people that has sets of questions that you score, which will give you a sort of quantitative idea of their mood. So the higher you score, the more likely you are to have a clinically diagnosable depression. And as you can see, across the age groups throughout that, LGBT plus adolescents and young people persistently scored higher on this questionnaire than heterosexual children in the same age group in basis of depression. So I think, again, this is massive. This is a huge thing that this group of people have a much higher risk of having mental health problems. So I think it's really important that we learn how to support them properly. Does that all sound okay for now, yeah? Finally, before I go on to talking a bit more specifically about transgender patients accessing our healthcare, I just want to have a quick talk about a Stonewall health report that they did via YouGov in 2018. Stonewall is an amazing LGBT plus charity. That is another really great resource if you're looking for education, if you're looking for somewhere to sort of suggest people to go and have a look for themselves. It's really good. So that's another really good thing to have a look up once we finished this chat. And they looked, as I said, at 5,000 LGBT plus adolescents, and they found that 50% of those that completed the survey had reported some kind of depression in the previous year. Again, you've got to admit that is a massive number, really, really big. And an eighth of those had had some kind of suicide attempt, which is really sad. But more importantly for this talk in particular, almost 50% of those that had identified as trans had thought about suicide in the previous year. And that's a huge, huge burden of mental health for this community. Once again, highlighting how important it is that we take care to be looking after this group of children. And then lastly, 1 in 4, almost a quarter, of LGBT plus people had witnessed some kind of discriminatory or negative remarks against the community by healthcare staff. And in the last year alone, about 20% of transgender people that were completed the survey had witnessed these remarks. I'm talking about some kind of communication that was deemed to be offensive or discriminatory. And that's, again, a really, really big number. I'm sure we all very much value the teams that we're in. I certainly, whilst I've worked in London, have had no problems with the teams I've worked in. But this kind of highlights that we might be having discriminatory communication without even knowing about it. And we won't know about it unless we think about it. This is just a slide with some different terminologies that are used in the LGBT plus community. And in the small group sessions, it's really, really useful to sort of, for people to have an opportunity to ask about certain things that are used in the community. I appreciate that maybe this is not the easiest way to ask a question on a forum like this, but if anyone has any questions about any of the terminologies on this page, please feel free to ask now. And it's a chance to sort of be able to talk about it in a safe space, I guess. Yeah, Gigi. So Two-Spirit is a one that is often, I think, has always been the one that normally is asked about the most for me when I've done this talk. So Two-Spirit, effectively, from my understanding, and again, please feel free if someone is on the talk that wants to give more information if they do know, is when a person sort of has two different identities that are quite unique to themselves. To each other. So they might find that on some occasions they identify as a female, and on some occasions they identify as a male. And rather than them being a blend of their personality or their identity, they're actually quite distinct identities of themselves. Rather than someone being a transgender woman who identifies as a woman. And I think that sort of highlights that actually we're finding out more and more as people are becoming more comfortable with exploring their gender identity and then their sexualities, that it's not as binary as we all think it is. It's such a huge range of the way that people identify and and how they present themselves and how they feel comfortable, that I think it actually shows quite nicely that maybe this is a much more fluid thing, and identity is a bit more fluid than we give it credit for. And that's why I think all of these terminologies are coming into play. As I've already said previously, I think some LGBT plus, some transgender people in particular, really benefit from having a label attached to them, whereas some people might not find that useful at all. And as I'll talk about later on, I think that's one of the things that we have to be really careful about, is not labeling someone that doesn't want to be labeled, and using the appropriate labels for people that want them to be used. Does that make sense? Perfect. Awesome. And the one I really want to highlight is allies. And what I'm hoping that this will achieve is just promoting us all to be more allies of the LGBT plus community, and particularly of transgender people. And allies are basically people who promote education, promote learning, and promote protection of these children. Thanks, Nicola. It's a really interesting question, and I think it's something that comes under a lot of heat in the media. So for people that aren't looking at the chat, Nicola has just asked about if we know if fluidity changes with the age and stage of life. And I think I'll go on to talk about it really briefly again when I'm talking about barriers to things. But I think what we know about fluidity as it changes in life gets sensationalized quite a lot in the media. So the things I think about is you see a lot of the tabloids publishing things about how there's transgender people that have transitioned very early on in life that then get to their 20s or 30s and regret that decision. I think, again, it's something that we don't really know everything about. It's a thing that we're learning all of the time. But when you look at what the Tavistock do, they are very much more on working with these children that present to them with gender identity concerns or exploring their identity, is they promote them to explore it rather than trying to pigeonhole them. So if someone, say, for example, a biological male is exploring the process of being a transgender female, they won't immediately go down the route of treatment. They will work with them exploring their fluidity and work with them as a long-term process rather than being like, you are going to be transgender at the moment. And I think the more the emphasis from a healthcare service is now more on providing support as they explore that fluidity, because no one's saying that it is set in stone. Does that answer your question, Nicola? Perfect. Thanks, Ed, for your question. So Ed asked, advice for pediatricians when asked to talk to their 13 or 14-year-olds who are worried they might be gay. Check if you're gay yourself. Yeah, it's I do remember your story. I think it's, again, something that I'll talk about. I think it's really important to just be open if you feel like it's important, and exactly, you've got to um if you've got to allow them to explore it if they want to. So if this comes up in a conversation, whether it's gay or whether it's more particular to this conversation, whether they're transgender, you can ask them if they want to explore it with you. And if they do, that's brilliant. And if that is part of something that you're comfortable talking with, that's fine, that's great. Um, but if you're not, then that's also fine. You can give them different support networks, which I'll talk about. And I think it's important for us as pediatricians to have the things that we need to provide them ongoing support and give them the right referrals. I think what is also important is we don't know on the first line where that person is in working through their identity or their sexuality. Um, it's difficult to, I think it's really important that we don't push them to talk about something that they're not ready to. I'm just reading Jess's comment, who very interestingly, I didn't realise, Jess, that you were at King's at the moment, and I've used your paper in an upcoming slide. Then I saw this morning that you're working there. So if everyone wants to read Jess's comment, that's really, really important. And yes, exactly what Jess is saying. So I think we, going back to what Nicola had asked, I think you hear one story where someone has maybe had difficulty with wanting to move back on potentially moving down medical treatment for changing their gender. And the media kind of jump on that one sensationalist story and make it sound like there's huge numbers of transgender people accessing this care that then regret it. And I just don't think that is the case at all. And as Jess has pointed out, that isn't really, when we've looked at studies, this doesn't really happen. So I want to just now move on to really specifically talking about how we can support transgender patients accessing our healthcare. But as Ed has already sort of said, I'm also happy to extend the banner to the LGBT plus community as a whole. So can anyone think of any barriers that are put in the way that we currently practice medicine, and whether it be in A&E, in an inpatient setting, or in our clinic setting? Can anyone think of any barriers to effectively communicating with these children and adolescents? Yeah, Katie, exactly right. So a lot of the hospital systems that we use, I know that they've got a lot of problems anyway, and they're all ancient and archaic, but a lot of them have very binary gender. So you will almost definitely on most systems have to be placed as male or female. So I definitely agree, our computer systems can have a real negative effect. Yeah, exactly. I think, Hannah, you're right. I think having fears of saying the wrong thing, I think if you are worried about saying the wrong thing, even if you end up not saying the wrong thing, I think your body language will probably then feed into that. And I don't think a transgender person can truly feel comfortable accessing our healthcare if we give off that sort of concern and worry. I think that's a really good point. Yeah, perfect, Avner. I think that's also a really good point, is sort of not knowing where the line is and where you want to discuss. I think these are all really good points. Other things I've thought about are communication between teams. I think it's a really thing that you really need to get right. For example, if you're referring a patient into inpatient from Peds A&E that identifies as transgender, Joanne that I was telling you about was telling me a story about how she had ended up on a male ward because of the way that the handover between teams had happened, and she found that really difficult. And the communication between teams is actually identified as female didn't really go quite smoothly. And as a result, every new person that she met ended up having to chat to them about where she stood. And she felt really comfortable. She was fine with that, but other people mightn't be. So I think we've got to be really careful with our communication, whilst at the same time being very aware that this is a confidentiality issue. And I've certainly unfortunately seen situations where it almost becomes a bit like gossip, and all of the team is talking about a transgender person that is currently in the clinical setting. And I think we've got to then, as people that hopefully will work out towards being allies, to try and stop that sort of thing happening. I've already talked about IT systems, we've talked about barriers. Communication between parents, I think, can be really difficult, especially if the parents are not on board with that child's identity. And I think that's a really difficult situation that is just really hard and can become a safeguarding issue, which I'll talk about shortly. I've already talked about the general media, and I think one story can be used to sweepingly talk to everyone else that might be potentially not in the same boat at all. And as Jess has said, the numbers of people that go through some kind of medical or surgical therapy that then regret it is so small, but they're the stories, unfortunately, you hear about in the tabloids. You don't hear about the huge number of transgender patients that are happy. And I think that sort of bad press can promote the sort of things that Hannah was talking about, the fear of saying the wrong thing, and I'm saying not sure what to talk about. And then I think what's actually really interesting is sort of that inbuilt heteronormative language that I hold my hands up and say I am having to learn not to use. And I think the one that sticks out in my mind is I've heard on so many occasions when you're trying to create a rapport with a teenager, um, someone potentially asking something like, have you got a girlfriend? Have you got a boyfriend? Or when it's a younger child, being like, oh, you're going to have all of the boys or girls when you grow up. And I think that sort of language, that assumption that a boy is going to end up having a girlfriend or vice versa, I think is really built into our language in the UK. And that's something that even I have to be constantly thinking about to stop myself doing. I'm sure my partner Orion wouldn't mind, and he's sitting in front of me, so I'm sure he will tell me. He struggles, he's going through an identity crisis, and I literally just then said he instead of they. It's something that I am constantly having to challenge myself to make sure I'm using the right pronouns for them, because I still sometimes make mistakes. And I'm sure all of us have been in situations where we've made a mistake and felt horrible about it. And it's just something that we have to constantly be working on, I think. So I've already said, Jess, here is your paper from the BMJ in 2019, who talked about safeguarding LGBT plus adolescents. And I think this is another important thing we need to think about, is that these children are at higher risk of safeguarding concerns. And as clinicians, safeguarding needs to be at the forefront of our minds a lot of the time, especially whenever we're seeing any children. So just some of the things that they're higher risk of, they're at much higher risk of self-harm. They're at higher risks of having difficulty with parents. Up to 40% in a survey by the government found that up to 40% of children had had problems with bullying in school related to either their sexuality or their gender identity. There's a higher level of alcohol and drug use. And I think something I found really shocking in a survey really recently, so like late 2010s, was that 8% of LGBT plus adolescents that had been surveyed in this survey had been offered or sort of referred to some kind of conversion therapy, which I personally thought was non-existent in this country before I read that. I was really, really surprised. Um, so there's still lots of issues with safeguarding. We've got to be thinking about that as well. So thinking now, just as because I'm aware it's 25 to, and there's another talk at 1, I just wanted now, we've talked about some of the barriers that might be in place for transgender patients. What kind of things can we do as a group of clinicians? What can we do to sort of support transgender patients accessing our healthcare? Perfect, yeah. So NHS Rainbow Badges are a really useful way and a useful way of of sort of non-verbal communication to show that you are aware of the community and are aware that this community exists. And even seeing that for a patient might make them feel a bit more comfortable talking about any transgender things that they want to talk to you about, and maybe feel a bit more comfortable to talk to you. Yeah, you're right, Nicola. I think it's obviously not something that we see in the healthcare, but it's something that goes on in conversion does apparently still happen quite a lot in religious institutions. Speaking about NHS Rainbow Badges, I had a trans flag badge that I also have on my lanyard, which is another useful way of showing that you are aware of the community. Anything else we can do? Yep, Katie, that's really important. You're going to be mindful of your language more. Um, Again, as I said, I'm giving a talk on transgender awareness and I just misgendered my partner. So it's a constant learning process, something that you constantly need to be challenging yourself for. So I think talking about your language is really important. One thing that Yep, I'm just looking at what King's EPR are putting on. Yeah, we said that it's one anyone can refer, and it's really important to be aware of that service. I think thinking about direct questioning versus openness is something that is really important. And please, Jess, if you have any more thoughts on this, because you've wrote this paper, I think in some situations it's important to be direct. So going back to the first case where there was a lot of question about how the transgender boy should be approached and had been booked on with his biological gender, I opened with, "Hi, I'm Dean. I'm a pediatric doctor here today. My pronouns are he and him. What would you like me to call you? What's your name? What pronouns would you like me to use?" And then felt like that direct questioning can sometimes be really appropriate in showing that you not only are aware that they are transgender, but allows them to set how they want to be talked with. And if there's any confusion or concern, you can just use their name. You can just use their name instead of using a pronoun. But I think it's also really important to be careful about then using that and placing them in a box. So if someone is booked on the system and identifies as male but is biologically female and uses the pronouns he and him, they might not necessarily identify specifically as trans. So then or using that terminology, I think we've got to be really careful about and being careful to not then pigeonhole people that maybe don't want to be pigeonholed. I think it's also really important to allow these children to dictate the flow a little bit and not force anyone into talking about something that they're not necessarily comfortable with. I think that's when it's really important to be really hyper aware again of how we're talking to these adolescents. And thinking about the clinical environment can be really important. So making sure that you've got things around the environment that show that it is a safe space and thinking about how we can help. And I think that really comes down to education effectively. So as I've said, I don't think it's necessarily a bad thing to identify a person's pronouns. I was talking to someone at Stonewall who said that a lot of their staff automatically now, as they're introducing themselves to anyone, automatically then use their pronouns straight away. So we'll say, "Hi, I'm Dean. I use the pronouns he and him." I think I'm not necessarily saying that's everything we should all be doing, but I think it's a really good way of highlighting awareness to patients that are using our systems. And providing education for staff and continuing to educate yourself is really important. And then involving the appropriate teams can be really, really useful. And just trying to be an ally as much as you can. I'm just going to have a quick look at the chat. I'm sure you weren't a registrar in the Dark Ages. Personally, that's not something I know about, but it's something I'm sure will be available if we go looking for it, and it's something that I will try and look up and then potentially send out in an email or something like that. I imagine that things are becoming a lot more holistic. I know that the GIDS service is a lot more holistic in their approach rather than it being as sort of very clinical that intersex was. Hannah's popped some good links up there on the Evelina Rainbow Badges thing. Here's just some links that you can go to, and you can Google them to find them. Mermaids is individual support for trans and gender diverse people. Please look up the GIDS service. I think it's really, really useful to just be aware of. Stonewall has loads of stuff on LGBT plus rights charities. And I also think, so I've said a few times, Joanne Lockwood is this person that organises teaching quite a lot for NHS teams on transgender communication, and she offers hour-long sessions to full-day sessions where she talks a huge breadth about what it means to be transgender accessing healthcare. And I found it so enlightening and so educational. Santalia's offered it last year and it was brilliant. And it's something that if you or your team are really interested in, it's something that you could talk with. I don't know how Helia's organised it, but you could be in talks with potentially organising something similar. Hannah, you can go on her website. I will post it on like sort of some of the education groups, and we can then forward them round each other. But if you Google her, she comes up because she's a big deal. She does like lots of international stuff as well. And that's really all I wanted to talk about. I hope in some way it's been educational. I hope that it hasn't been something that everyone knows about and has got everyone thinking. Has anyone got any other comments or anything they'd like to talk about? Anything else that they'd like to ask? So that's a really interesting question. So someone's just asked, so can the term transgender be mentioned in the medical notes? Or do you say we should not use it? It's difficult. I think if you think it's a really great area between if it's important to someone's treatment, then we should be making aware of other teams, but also it's really careful that we don't just stigmatize it. I think what is more important is for things like medical note taking, it's important if someone is non-binary or identifies in a different way to how they potentially are put on the system, it's important for us in the clinical notes to make that aware so that people aren't constantly guessing. But I think you've also got to be really careful not to assume things either. Absolutely, yeah. So that's a really good point. If you're going to use it, it's not issues is transgender. That's not a thing. So if someone, say, if you have got someone that is transgender who has came in with an intentional overdose, their presentation is not transgender intentional overdose. It is overdose, and somewhere in the notes you could reference the fact that that person identifies as female or male or whatever it is. Yep, Sally, there's lots of things. If you go onto things like Stonewall and the GIDS service, on the GIDS service there is a section for patients and a section for parents as well to help educate themselves. And then, as I said, like there's lots of different charities for LGBT plus that can help the communities and help parents help as well. Um, so did you just ask about how to communicate this in handover? I think that will only come in time. I totally get what you are saying when it results in people covering the whole conversation. I think because a lot of people aren't really comfortable with communicating with transgender people still and have difficulties, I think then it becomes such a storm in a teacup when you're handing over because everyone wants to know the back end of everything, which isn't what it should be. I think trying to keep, when, say, Gigi, if it's yourself that is handing over, trying to keep it brief when you're handing over, and then trying to stop people then trying to talk about the whole story. If someone Yeah, that's really important as well, Nicola, asking people what people want to know, because it might be someone comes to you for something completely different and then tells you that they're transgender, but might then not want you to talk to anyone about it. So it's just been, I think it's been open and is really important. I think going back to what you were saying, Gigi, I think if it is important to the handover, mention it, but then by being as you become more comfortable as a clinician in general, for any of us, we might feel more comfortable telling people that something that they're asking isn't necessarily got anything to do with that person's care. I've heard transgender people be asked how they are intimate with their partners and sort of really crazy things that you would never imagine someone would ask. And it's about, I think, when you think something maybe isn't important, potentially what we could do as allies is say during that handover, I don't think that is really pertinent to this person's care. It's probably be the best way of tackling it, becoming a life story of that person in general. Perfect. Thank you so much for listening, everyone. I really hope that it was helpful in some way. I'll stop now just so people can get ready for the next talk. But if you have any questions, please you can email me. I'll put my email now in the chat if you want to ask anything else that's maybe something you didn't want to ask on the forum. Um, or yeah, just have a look at some of those things and potentially think about what we could be doing to further educate ourselves. Thank you so much, guys. I hope you enjoy the rest of your day. And see you all soon.